Greetings from the USF College of Pharmacy. This is Group 10. Today we're going to be discussing how to address cultural competency and diversity in the geriatric population. Today we're going to describe what culturally competent healthcare is. We will explain the importance of language access services. We will describe organizational support systems. And finally, the importance of etiquette and culturally appropriate treatments. A culturally competent healthcare system accepts the existence and importance of culture and must be able to adapt their services to meet the cultural needs of their patients. As cultural diversity is expanding within the geriatric population, this is becoming more of an issue. As a pharmacist, it is important to recognize and understand cultural and spiritual beliefs as they can guide the decisions of your patient.
The biggest source of noncompliance amongst the geriatric population is lack of comprehension. Low literacy levels are extremely prevalent within this population as well. Pharmacists can overcome these barriers using slow communication, basic terminology, and visual aids with information about safe medication use. Medical interpreters are used in the pharmacy setting to provide a direct link for communication with the patient. They also assist in the development of culturally competent health and medication literature, as well as speaking with the patient in their native language, consequently allowing the patient to feel more comfortable and communicate more effectively. Medical interpreters also ensure that instructions are given in the most effective manner and serve as an individual to greet an elderly patient and make them feel more comfortable knowing that there is someone present with their same cultural beliefs. All of these examples prove the necessity for providing healthcare facilities with a medical interpreter and combating cultural diversity.
Here we're going to talk about drug information materials geared towards the culturally, religiously, and educationally diverse geriatric population. These graphs show the population distribution in Florida and in the U.S. between 2010 and 2011. The Caucasian population is predominant in both graphs. However, the other ethnicities such as African American, Hispanic, and others such as Asians and Native Americans make up a combined 1/3 of our population. This means that 1 out of every 3 patients is a minority. This chart is a compilation of various patient populations, their general beliefs and characteristics, and how to approach them in a culturally sensitive way. Some of the general characteristics of these patients include an unwillingness to share personal information due to lack of trust or passivity in the presence of an authority figure. Some culturally competent approaches include addressing patients formally, explaining reasons for obtaining information, and including the family in treatment discussions. Since Latinos represent a significant portion of our population, we could possibly provide educational materials such as pamphlets or brochures written in Spanish. This will aid in bridging the cultural gap between providers and patients. This table shows the benefits of practicing in a culturally competent way. Some benefits include increases in quality and effective care, and decreases in health and mental health disparities, system costs, and bias and discrimination.
There's a growing number of Asian immigrants in the United States from Africa, Caribbean, West Indies, Haiti, Jamaica, and Latin America. These groups have a large difference in education, religion, social economic background. Not understanding different culture diversity can put a hindrance on improving patients' overall health. Continuing education courses should be offered regularly to healthcare providers on cultural competency and diversity in the elderly. Health literacy should be evaluated. Overcoming language barriers and alternative health remedies should also be focused on. For example, the island community is really immersed in herbal medicine and might not believe in drug therapy as a treatment of choice. It could lead to adherence issue. Also remember, many immigrants came to the United States to escape racial discrimination, poverty, and oppression. Elderlies from each of these subgroups will approach healthcare from a point of view shaped by their life experience with the formal health system. So understanding culture and religious belief is important.
In conclusion, we have discussed how cultural competency is directly related to poor patient outcomes, reduced patient compliance, and increased health disparities, regardless of the quality of services and systems available to patients. In order to achieve cultural competence, there are 4 very important self-reflective components that one must assess. The first one is awareness of one's own cultural worldview. You must also assess one's attitude toward cultural differences. Also, knowledge of different cultures, practices, and worldviews is essential. And then finally, acquiring cross-cultural skills will be necessary. The benefits of culturally competent pharmaceutical care are obvious within the geriatric population. You get increased healthcare-seeking behavior from patients, less drug complications, better education, and overall improved rates of medication adherence. In conclusion, cultural competence requires a patient-centered approach. A pharmacist has to understand cultural competency in order to be able to communicate with and effectively interact with people across cultures, ethnicities, and ultimately age groups to effectively treat the geriatric population.